Lyme disease, a growing concern worldwide, often remains hidden in plain sight. This complex illness, caused by the bacterium Borrelia burgdorferi, spreads through the bite of infected black-legged ticks. Early diagnosis and treatment are crucial, as untreated Lyme disease can lead to severe long-term health complications. Join us as we delve into the intricacies of Lyme disease, empowering you with the knowledge to protect yourself and your loved ones. Lyme disease is caused by a bacterium called Borrelia burgdorferi. These bacteria are primarily transmitted to humans through the bite of infected black-legged ticks, commonly known as deer ticks. These tiny arachnids, often no larger than a poppy seed, latch onto their hosts, embedding themselves into the skin to feed on blood. As the infected tick feeds, the bacteria transfer from the tick's gut into the bloodstream of the host. The bacteria then begin to multiply and spread throughout the body, potentially affecting various organs and systems. The longer the tick remains attached, the higher the risk of Lyme disease transmission. While black-legged ticks are the primary culprits in spreading Lyme disease, other tick species can also carry and transmit the bacteria. These include the western black-legged tick, found in the western United States, and certain species of ticks found in Europe and Asia. It's important to note that not all ticks carry the bacteria that cause Lyme disease. Even if an infected tick bites you, it doesn't necessarily mean you will develop the illness. However, it's crucial to take preventive measures to minimize the risk of tick bites, especially if you live in or visit areas where Lyme disease is prevalent. A Lyme disease is often challenging to diagnose, as its symptoms can vary widely from person to person and often mimic those of other illnesses. Early signs and symptoms, if present, typically appear within 3 to 30 days after a tick bite. One of the most characteristic signs of early Lyme disease is erythema migrans, a distinctive circular rash that often resembles a bullseye. This rash typically appears at the site of the tick bite and expands gradually over several days. However, it's important to note that not everyone with Lyme disease develops this telltale rash. Other early symptoms of Lyme disease can include fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. These flu-like symptoms can be easily mistaken for other viral infections, making it crucial to consult a healthcare professional if you experience these symptoms, especially after a tick bite or exposure to tick-infested areas. As Lyme disease progresses, the bacteria can disseminate throughout the body, potentially affecting various organs and systems. This can lead to a wide range of symptoms, including severe headaches, neck stiffness, facial palsy, arthritis, heart palpitations, dizziness, nerve pain, and cognitive difficulties such as memory problems and brain fog. Diagnosing Lyme disease can be challenging, as its symptoms often overlap with other conditions, and conventional testing methods have limitations. A comprehensive approach, combining clinical evaluation, patient history, and laboratory testing, is essential for accurate diagnosis. When consulting with a healthcare professional, providing a detailed history of recent tick bites, potential exposures to ticks, and any symptoms experienced is crucial. The doctor will conduct a physical examination, assessing for any characteristic signs of Lyme disease, such as the erythema migrans rash. Laboratory testing for Lyme disease typically involves a two-tiered approach. The first step is an enzyme-linked immunosorbent assay, ELISA, test, which detects antibodies produced by the body in response to the bacteria. If the ELISA test is positive or inconclusive, a Western blot test is usually performed to confirm the diagnosis. However, it's important to understand that these tests are not foolproof. They rely on the body's immune response, which may take several weeks to develop after infection. False negative results, especially in the early stages of Lyme disease, are not uncommon. Section 5. Battling the Borrelia treatment options for Lyme. The good news is that Lyme disease, when diagnosed early, can often be effectively treated with antibiotics. The type and duration of antibiotic treatment will vary depending on the stage of the illness, the severity of symptoms, and individual patient factors. For early localized Lyme disease, characterized by the erythema migrans rash and flu-like symptoms, oral antibiotics are typically prescribed for a course of 10 to 21 days. These antibiotics help to eliminate the bacteria and prevent the disease from progressing to later stages. In cases of disseminated Lyme disease, where the bacteria have spread to other parts of the body, intravenous antibiotics may be necessary. Intravenous therapy delivers higher concentrations of antibiotics directly into the bloodstream, effectively targeting the bacteria in various tissues and organs. While antibiotics are the mainstay of Lyme disease treatment, some individuals may experience persistent symptoms even after completing a course of antibiotics. This is known as post-treatment Lyme disease syndrome, or PTLDS, and its underlying mechanisms are still not fully understood. Section 6. Shielding yourself from the bite preventing Lyme disease. Preventing Lyme disease starts with understanding how to avoid tick bites. Ticks live in grassy, wooded, and humid environments, so taking precautions when spending time in these areas is crucial. When venturing outdoors, wear light-colored clothing, which makes it easier to spot ticks. Tuck your pants into your socks to create a barrier and prevent ticks from crawling up your legs. Apply insect repellent containing DEET or picaridin to exposed skin and clothing, following the instructions on the product label. After returning from outdoor activities, conduct a thorough tick check on yourself, your children, and your pets. Pay close attention to areas where ticks like to hide, such as the scalp, behind the ears, under the arms, in the groin area, and behind the knees. If you find an attached tick, remove it promptly and carefully using fine-tipped tweezers. Grasp the tick as close to the skin surface as possible and pull upward with steady, even pressure. Avoid twisting or squeezing the tick, as this can increase the risk of infection. Section 7. Lyme disease in numbers, facts, and figures. Lyme disease is a growing public health concern, with an estimated 476,000 new cases diagnosed each year in the United States alone. The Centers for Disease Control and Prevention, CDC, reports that Lyme disease is the most common vector-borne illness in the country. Lyme disease is most prevalent in the Northeast, Mid-Atlantic, and Upper Midwestern states. However, it has been reported in all 50 states and is expanding its geographic range. The increasing prevalence of Lyme disease is attributed to factors such as climate change, suburbanization, and the growing deer population. Early diagnosis and treatment are crucial in preventing the long-term consequences of Lyme disease. Untreated Lyme disease can lead to severe complications, including chronic arthritis, neurological disorders, heart problems, and cognitive impairment. Despite the growing burden of Lyme disease, research funding for this complex illness remains inadequate. More research is needed to improve diagnostic tests, develop more effective treatments, and better understand the long-term consequences of Lyme disease. Section 8. Lyme disease. The importance of early recognition. Lyme disease, often dubbed the Great Imitator, presents a significant diagnostic challenge due to its wide-ranging and often subtle symptoms. Early recognition and diagnosis are paramount in preventing the debilitating long-term consequences that can arise from untreated Lyme disease. One of the most crucial aspects of early recognition is being aware of the possibility of Lyme disease, especially if you live in or have visited areas where Lyme disease is prevalent. Knowing the signs and symptoms to look out for, such as the erythema migrans rash, flu-like symptoms, and neurological manifestations, can help individuals seek medical attention promptly. It is essential to remember that not everyone with Lyme disease develops the characteristic bullseye rash. In many cases, the symptoms can be vague and easily mistaken for other common illnesses. Therefore, it is crucial to consider Lyme disease as a potential diagnosis when experiencing unexplained symptoms, especially after a tick bite or exposure to tick-infested areas. Timely diagnosis and appropriate treatment are essential in preventing the progression of Lyme disease to later stages, which can involve more severe and persistent symptoms. The earlier Lyme disease is diagnosed and treated, the better the chances of a full recovery. Section 9. The future of Lyme disease, ongoing research and hope. While Lyme disease presents ongoing challenges, there is hope on the horizon. Researchers around the world are tirelessly working to unravel the complexities of this debilitating illness and develop more effective diagnostic tools, treatment options, and preventive strategies. One promising area of research focuses on developing more accurate and reliable diagnostic tests for Lyme disease. Current testing methods rely on the body's immune response, which can take weeks to develop and may not always be detectable, leading to false negative results. New diagnostic approaches, such as those targeting the bacteria's DNA or RNA, are being explored to improve early detection rates. Another area of active research is the development of novel treatments for Lyme disease. While antibiotics are effective in treating early-stage Lyme disease, Persistent symptoms can occur in some individuals, highlighting the need for alternative or adjunctive therapies. Researchers are investigating new antibiotic regimens, as well as therapies targeting the immune system and inflammation. Prevention remains a cornerstone in the fight against Lyme disease. Ongoing efforts focus on developing more effective tick repellents, as well as exploring strategies to control tick populations in endemic areas. Public awareness campaigns play a crucial role in educating individuals about the risks of Lyme disease and empowering them to take preventive measures.